Okay, well, thanks very much for asking me to present at the National Health Careers Conference. I'm Adrian James, I'm the President of the Royal College, and I'm really delighted to be here. I think there's never been a more important time that we need to encourage people into health careers, and particularly careers in mental health. I hope you're all safe and well. I hope you're all enjoying the conference and the versatility that these sorts of platforms give you. So this is me, Adrian James. I'm the 47th President of the Royal College. I won the presidential election at the start of 2020. My presidential election was much easier than the current one that's going on, and I'm glad to say that there were no disputes about the voting, so all straightforward. I'm a forensic psychiatrist and a frontline clinician. I've been a psychiatrist for 33 years. And it's had its challenges, but I can really say that I've really enjoyed my career. It's been a fantastic professional life. And forensic psychiatry is that branch of psychiatry that looks after people with some of the most severe mental illnesses who find themselves, unfortunately, in conflict with the criminal justice system. And it's my job to take them out of the courts, out of prisons, and address issues to do with their mental illness and a whole load of social factors and social determinants of mental ill health, and really try to help them to put themselves back together so that they can leave hospital and get on with their lives. So my priorities are four: equity between physical and mental health, championing diversity, supporting the workforce, and putting sustainability at the heart of everything we do. So the history of the college: this is the college building. It's just sort of bricks and mortar. It's not what the college is. The college is all our 19,200 members. We're a global college. We have about 4,500 members outside of the UK. So what's the purpose of the college? Well, the college isn't a club. It's not there for psychiatrists. We're actually there for patients. We're there to improve outcomes for patients. So we do that by setting standards and promoting excellence in psychiatry. So we spend a lot of our time looking at what the best sort of care should look like and how we can bring that about. We lead, represent, and support psychiatrists. Importantly, we work with patients, carers, and other organisations that are interested in mental health, so the big mental health charities such as Mind and Rethink Mental Illness, and we represent the expertise of the psychiatric profession to government, and that's never been more important. I have regular meetings with the English Health Secretary, Matt Hancock, with Chris Whitty, Steve Powis, the medical director of the NHS, and actually politicians across the whole of the spectrum of politics. So it's intensely political, mental health, and so there are great opportunities now because people are really listening and taking it seriously. So in terms of our college values, it's very easy to think, well, you know, why would you want to talk about values? But values, I like to think of being something like sort of an anchor that you go back to when you're thinking, well, what are we all about? What's our approach to things? And our values spell out circle. So courage, we do need to be courageous in the mental health world. We need to fight for what we need, what our patients need. Innovation, we always need to be looking to see what's the next stage, what's the best way of doing things. Respect, we need to look after each other, and we need to look after our patients and respect everybody's perspective. We need to work together, we need to collaborate. We need to endlessly learn. We're a continuously learning organisation, and above all, we need to strive for excellence. So in terms of my priorities, I think one of these I was asked to talk about was, are we getting it right in mental health? Well, we've shown that where you do invest in services, we can make a real difference to patients. So we've had substantial investments in things like perinatal mental health services, so mental health services at the time that women are pregnant or just after giving birth, when they can experience quite severe mental illnesses. And we've invested heavily in that, and it's absolutely transformed what we can do. And in liaison services, so psychiatrists working in the general hospital, again, transformed the services. But we've got a way to go. And there's lots of investment that's going into mental health services. There's more investment promised in years to come. And we know that we can get it right if we have that investment and if we have the workforce, and that's where you all come in. And I think it's a great time to be going into psychiatry because it's a specialty that's really developing. And if you go into that specialty, you can help to shape it rather than going into a specialty that's rather sort of, it is as it is. You really have a chance to shape what happens if you become a mental health professional. So championing diversity is really important to me. The tragic killing of George Floyd really, I think, really just sent shockwaves through the whole of the world, and rightly so. And also the picture on the right is the health professionals who have died through COVID. And again, COVID has shown us that there are people who are particularly adversely affected and by a variety of situations. And we need to do all we can to ensure first that patients from diverse backgrounds get services that they actually want to engage with, that they have equal access, that they have a good experience of services, and that their outcomes are equally good. And that's not the case at the moment. We've got programs going on to ensure that is the case, but also in terms of health professionals, we need programs to ensure that everybody can give of their best. We know that a diverse workforce is a better workforce, and actually outcomes are better if we value diversity. And again, I'm introducing a number of programs to ensure that that's the case. So my next priority is placing sustainability at the heart of all we do. And the NHS has a huge carbon footprint. Mental health services have a huge carbon footprint, and we need to address this. We need to do all we responsibly can do to address that. The two biggest areas are travel and actually medication within the health service, and procurement generally, and all that goes with that. And I want to paint a vision, not of taking fun things away that we would really like to do, we've got to stop because of sustainability. I want to paint a vision that actually is a very positive vision and actually is about improving people's lives. For example, improving access to green spaces for our patients, which is good for their mental health. So it's a very positive future. I'm a great cyclist. I cycle to work in Devon. It's a 50-mile round trip. I cycle in London on my Brompton, and that's one of my contributions to this, but it's really important that we address this. So my fourth priority is recruiting and retaining and looking after the workforce. And why must we recruit and retain more psychiatrists? Because we've got big ambitions for mental health. We've got a long-term plan that's got an increase in the workforce as part of that. So we need to attract more people into our specialty. And the impact of COVID-19 on mental health services has been huge. And we know that after pandemics, that the mental health effects of it, they roll on for about 18 months to 2 years. And I've been talking to politicians about this and said, you've said you'll fund all the health service needs for the pandemic. That must include the mental health consequences. And we know that anxiety levels have gone up, depression levels have gone up, and things like post-traumatic stress disorder, particularly for those who have been ventilated, and the impact on our staff. So again, this is another reason we need more people coming in to work in mental health services. And actually, we've had an over-reliance on international recruitment. We've got fantastic people who come from overseas and work in our services. We want to continue to have those links on a reciprocal basis to work with people so that psychiatrists from the UK can get the real value of actually experience in other parts of the world. But we mustn't drain the resources of other countries who need their psychiatrists too. So we need to train more psychiatrists in this country. So in terms of our workforce strategy, we've got 5 key work streams. And this if you choose a career in psychiatry, this will affect you greatly. So we're increasing recruitment and promoting innovation. We're promoting flexible working practices because we know that that's what appeals to people. We want to improve retention and well-being and have a more resilient workforce. We know that if you improve well-being, people feel better about what they do, and actually they provide a better service for patients. we're promoting psychiatric leadership and improving the culture. And we're looking at recruiting and retaining into different sorts of roles in mental health services, such as physician associates, so not just pure medical roles. So we have had a Choose Psychiatry campaign. I hope you've seen parts of it. I've got a video. I hope that it plays later on in my presentation. And we mounted this campaign. We went into schools, we went into medical schools, worked with foundation doctors. We've had a social media campaign to try to show people what a great career psychiatry is. And we provided support to medical students and foundation doctors through various schemes, such as our Psych Star scheme. And our fill rate has gone up from 67.3% to 100% in 2020. So psychiatry this year, in terms of our recruitment, was absolutely full. And actually, we won an award for our campaign. But the campaign wouldn't have worked unless people really see that psychiatry is a great career. So in terms of our PsychSocs, the college is in contact with PsychSocs at 40 universities around the 4 UK nations. We support the PsychSocs with bursaries of up to £500. I get asked to give talks at psychiatry societies. These are medical students who have a particular interest in psychiatry as a career, and it's amazing. We get a couple of hundred people turn up to these meetings because there's so much interest in psychiatry. We support PsychSocs to run events and activities, and we have a Choose Psychiatry lead in each of our divisions. There are geographical areas of the college, and we have an annual conference run by a different PsychSoc each year. So in terms of our Psych Star scheme, all medical students with an interest in psychiatry can apply for the scheme. We provide mentoring and financial support, and plus a lot of other benefits as well, free access to journals and conferences. We've appointed 22 Psych Stars since the scheme came in 2019, and our Psych Stars also represent the college as ambassadors for psychiatry. So in terms of well-being and retention, retention is underpinned by good well-being. If people feel that they're nurtured, looked after, and properly supervised, and that they have control over their working environment, their well-being will improve, and they're more likely to stay in their jobs. So we've got a multi-pronged approach to this. So we're expanding our psychiatric support service. We're encouraging organisations to embed our Going for Growth plan, which has got a lot about well-being, really practical examples of things that can actually help people at the workplace. We're developing and training a network of psychiatrists trained in well-being in each part of the country. And I think really importantly, we're developing a quality improvement network called Joy in Work, which is going to have the backing of trust boards, but will empower local teams to do some practical things to improve their well-being. So in terms of a career in psychiatry, it's a great career. It has all the benefits of drawing on your medical, scientific and interpersonal skills. It brings the social, the psychological and the scientific together. So you go to medical school for between 4 and 6 years. You have your foundation training for 2 years. Now, half people in foundation training get at least a 4-month placement in psychiatry. Core training is for 3 years, where you'll see various different subspecialties within psychiatry, and then choose higher training. So my higher training was in forensic psychiatry, and that's now for 3 years. And then there you are, you're into your consultant post after that. So in terms of getting involved, you can join the Royal College. There's a associate membership, which is free for medical students and foundation trainees, and you have all the benefits of free journals and news and support. And we've run a huge program of free webinars for the college, and we're up to over 150 since lockdown. We've run whole conferences online, and in fact our exam now is entirely online. So I recommend that you look at associate membership. We've got the webinars I've mentioned, and there are some specifically aimed at applying for training in psychiatry. You've got the PsychSocs at universities. I'd really recommend that you join them. And if you really keen, you can actually look at joining up with our divisions or devolved nations. So we have a video as part of our Choose Psychiatry campaign, and this is it. I hope you can hear it. Okay, well, thanks very much for listening. I hope that was useful. If you want to contact me, I'm on Twitter, and you can email me at the email address there, adrian.james@rcpsych.ac.uk. I hope that you enjoy the rest of the conference. Please do look after yourselves and each other. The COVID-19 situation is likely to get worse, but it will get better. And I think by the spring of next year, things will be really very, very different. So look after yourselves in the meantime. And thank you for watching and listening.